Hi, everybody, and welcome to our May Ambassador Briefing. Today, we're going to be talking about Medicare and Medicaid, what that looks like in the budget proposals. And then after that, we will give updates on our advocacy opportunities and what's going on in the state. So with without further ado, I will turn the microphone over to my colleague, Mike Lee, who will give you the update on Medicare and Medicaid. So, Mike, you can take it from here.
Thanks, Ben. Can you hear me okay?
Yeah.
So I am just going to give a update on things going on the Hill regarding budget reconciliation and its impact on healthcare, in particular the Medicaid program and the Affordable Care Act, ACA marketplaces, where a lot of people, millions of people, get their individual and family coverage. So last Thursday, the House of Representatives passed their budget reconciliation bill on a party line vote. It was 215 to 214. And it's it's also its number is HR 1. It's also called the One Big Beautiful Bill Act. Um, and in addition to extending the 2017 tax cuts to offset that cost, it has some major changes to the Medicaid program and the ACA marketplaces to offset those costs. So uh, Congress is in recess this week. Um, the House passed bill now goes to the Senate, and Congress is back next week. I think I just said that. So the Senate will consider the House bill. They could make changes. They also have to go through the reconciliation process, which is basically a procedural rules where provisions of the bill have to be related to taxes, either outlays or uh, um, uh, uh, costs. And so a lot to be seen about what happens in the Senate. And if the Senate makes major changes to their bill, then they have to reconcile it with the House version. So Congress, the leadership on the Republican side, they are aiming to get the Senate bill passed by July 4th, I believe, or correct me if I'm wrong, or if John, or if it's to get everything wrapped up by July 4th. Uh, I believe that's the goal. We will see. In the House, there were factions in the Republican Party that created some difficulty in terms of trying to get the bill passed. You have moderate House Republicans who were concerned about the cuts to Medicaid. Then you had more conservative Republicans who thought the bill didn't cut enough money and added too much to the deficit. Um, in the end, they were able to pass it by one vote. There's similar factions on the Senate side, with moderates concerned about the cuts to healthcare programs and conservatives wanting to cut more spending. So we'll see how that plays out on the Senate side. So that's an update on the process and where things stand on the Hill. In terms of specific provisions in the bill, on the healthcare side, there are several changes to the Medicaid program that would effectively lead to loss of coverage for, I believe, almost nearly 8 million people on Medicaid, and would cut almost $700 billion from the program over the next decade, which would be the biggest cut in the program's 60-year history. In addition to that, there are changes to the ACA marketplaces that would make it harder for people to enroll in coverage, to keep coverage, and it would also make coverage more expensive for people, uh, especially those who receive the premium tax credits that helps pay for their premiums. Um, so taken together with the changes, the cuts to Medicaid and the changes to the ACA marketplaces, preliminary estimates from the Congressional Budget Office, the CBO, which is a nonpartisan arm of Congress that scores legislation. They estimate that taken together, the changes could lead up to 15 million people losing coverage between Medicaid and the ACA. So that's certainly concerning from AKF's perspective, because we are all about ensuring people have access to coverage. I'll just highlight some of the changes that are very problematic. On Medicaid, it would require states to implement work reporting requirements on certain Medicaid individuals between the ages of 19 and 64. And they would have to show that they are meeting requirements of 80 hours a month, either working or going to school or community service. There are certain exemptions for certain folks, but what it essentially does is it creates more administrative burden for certain Medicaid beneficiaries to show that they are eligible for Medicaid coverage. Because data shows most Medicaid beneficiaries are working, especially those in the expansion population. And we've seen what work requirements can do in previous years. So for about 8 months in 2018 and over into 2019, Arkansas, through a waiver, had a work requirement in their state. And in those 8 months, they saw a decrease of 18,000 people lost their Medicaid coverage. And it was overwhelmingly not because they didn't meet the work requirements. It was because of administrative reasons. They didn't provide documentation. They didn't reply to the notifications. They didn't receive the notifications. We've seen what these reporting requirements can do. It leads to loss in coverage, which explains why it would save the government money. It would require states to impose cost sharing of up to $35 per service on certain services on adults who get Medicaid through the expansion. There are some exemptions for certain services, but including primary care, mental health, and substance use disorder services. But studies have shown that any cost sharing requirements, especially on a low income population, can lead to people foregoing care because they can't pay that copay or that coinsurance for certain services. So those are just a couple of examples of the changes to Medicaid that increases burden on beneficiaries and leads to loss of coverage. On the ACA marketplaces, I mentioned that makes enrolling in coverage more difficult. An example would be that it would require pre-verification for people to receive premium tax credits and to enroll in coverage. The way it works now is people attest that their income and certain other factors, and then the marketplaces, based on that, can determine that they're eligible for premium tax credits, and that individual can get the premium tax credits and enroll in coverage while the marketplaces verify that information through electronic means. They check it against databases from Social Security, Department of Homeland Security in terms of immigration status, etc. And then if there's any mismatches between what the person attested and what the data shows, people get 90 days to work that out. And in the end, that 90 days, they continue to receive coverage and get their premium tax credits. The bill passed in the House would change that. It would pretty much do away with that attestation process, and people would have to pre-verify and provide documentation themselves to get coverage and to get premium tax credits. So again, just making it harder to enroll in coverage for people. And in terms of making coverage more expensive for people on the ACA marketplaces, there are certain formulas. There's a formula called the premium percentage adjustment that the government uses to adjust the amount of premium to set the annual cost sharing maximums, out of pocket maximums for people. And the bill would change that formula so that the percentage is uh, different, and it would result in people having to pay more out of pocket. The out of pocket maximum would be more based on this revised formula. Um, so it's just a couple of highlights of why the the changes are so problematic and why they could lead to coverage losses and increased costs. Oh, another major one on the ACA marketplace is it would essentially do away with auto re-enrollment, which is in which people who have coverage and then the next coverage year, if they don't proactively, shop and uh, click whether they want to re-enroll in the current plan or choose a different plan, they get auto-enrolled in their same plan or something similar if that plan is leaves the marketplace. Uh, the House passed bill would take away that auto-enrollment, and which would be problematic because nearly half of enrollees in 2025 you got coverage through auto re-enrollment. And especially younger people tend to rely on auto re-enrollment to get coverage, and you need younger, healthier people in the risk pool to keep premiums stable for the whole marketplace. And plus, you want everyone to have coverage. It's important for healthy people and people with chronic conditions or at risk for chronic conditions. So that was a lot. I will close it out with one other problematic thing with the House bill is that based on preliminary estimates of the total effect on the deficit of this bill, which would be adding, I think, $3.5 trillion over the next 10 years, that could trigger a provision from a 2010 pay-as-you-go bill statute that's in law that would require cuts to Medicare. It's called sequestration. And if this bill increases the deficit by a certain amount, then there has to be automatic cuts to Medicare of about $500 billion over 10 years. So obviously that would be very concerning for the kidney population and just all the people who are Medicare beneficiaries. So with that, I will happy to take any questions that people have.
And for anyone who has questions, you can post it in the chat itself, or you can just digitally raise your hand and I will call on you. No questions for now. That's okay. If you have questions in the future, you can just email me and I will gladly forward them along to the proper person. Not to put anyone on the spot, but it occurred to me that Bree is still relatively new and a lot of you folks might not have met her. So Bree, if you can just come back on, say hi, and just let folks know your state territory.
Yeah, absolutely. Hi, everyone, and apologies if my video delays. It sometimes does that in Zoom. Bree Schmidt, Associate Director of State Policy and Advocacy. I've been here about 2 months now. I come from the American Osteopathic Association doing their state advocacy. And my states are pretty much the whole South. And then I'm originally from South Dakota, so woot woot South Dakota. But I will have South Dakota, North Dakota, Iowa, Wisconsin, and who am I missing? One more I'm missing up that way, but I'll have those in the Midwest and then the rest of the South. So I can put my email in the chat. I will, of course, be messaging many of you as the new legislative sessions start for the 2026 session in January to see what we can get started in your state. So very excited to meet all of you and was glad to meet a lot of you during the fly-in.
And Jim, has Indiana as well.
Oh, in Indiana. Yes, thank you. That was my other one.
Well, thanks, Bree. And so I will talk about the the fly-in, technically called the Kidney Action Summit. But it's just a couple weeks ago. It seems like it was light years ago, but it was a couple weeks ago. This time it was an interesting group because of all the turnover we had in Congress, both on the House and the Senate. A lot of the offices we had targeted in the past for meetings, those people were either no longer in Congress or no longer in leadership. So it sort of opened up the opportunities for folks who have not participated in the past to be able to make it through. Just looking at the names we have here, we have a decent number of folks here that did participate, and some folks who have participated in the past. And luckily, I think we had the best weather we've ever had for a fly-in in the past, especially last year. That's when we had all the rain. And then after our training day, I drove back to Maryland and hit up 2 grocery stores and bought out their entire umbrella sections so that everyone could have umbrellas for the hill. This year, we ended up having our AKF branded umbrellas, which folks didn't need. Oh, Mike, we have a question here that says, can you please explain the difference between Medicare and Medicaid, and will this bill affect the auto enrollment of Medicare?
Sure. I'll address the last question first. No, it won't affect the auto enrollment of Medicare. In terms of the difference between Medicare and Medicaid, Medicare is health coverage for people over 65, or people with certain disabilities, or for most people, if they have a diagnosis of end-stage renal disease, they qualify for Medicare. And Medicaid is the health coverage program for low-income individuals, and that is it's run by this by the federal and the states. It's funded by the federal government and the states. So that's the difference. And a lot of people with kidney disease, especially ESRD beneficiaries, they are what you call dually eligible. So they qualify for Medicare based on their ESRD diagnosis. And then they also qualify for Medicaid because they are low income. And Medicare is the primary payer. And then Medicaid provides kind of wraparound coverage as well as coverage for other services that Medicare doesn't cover if the person fully is eligible for Medicaid as well. So.
Right. Any other questions? All right, so let's go back to saying, we did bring in folks from all over the country, a lot of states that we haven't had before or in a very long time. We had our very first inclusion of folks from South Dakota. One, I will highlight Marianne Stark, who actually travels in an RV year round. But South Dakota is one of the states where you just need a PO box and you can be listed as a resident from there. So I told Marianne she can just say she's a resident of every state and just bring the RV there when we need a little bit of advocacy assistance. And she said she's game, so we'll see how long that lasts. And it was interesting because it was in the beginning of a new presidency and a new Congress, where, as you know, the leadership in the Senate flipped. So it was an interesting dynamic because in the past there had been a split between the House and the Senate, or Congress and the White House. So this is the first time in a while it's been, at least for us, everyone from the same party. But we're thankful for new group of ambassadors we got out of this, the continued involvement of folks, and just to continue our state advocacy work. Like I always say, there's plenty of opportunities for everyone to get involved on the state level. I feel like I said every time, but there are lots of chances for you to see your elected officials in the district. Best way to do it is to get on their distribution lists. You can just contact your district office if anyone has trouble figuring that out. Just email me and I will gladly provide you the info. I'll put my email in the chat right now. But you can just ask them, get on a newsletter list or an email list. And a lot of times that is how you can find out when your representative or senator is going to be in the district. If it's a town hall meeting, county fair, a services event, a back to school event, or if it's a Thanksgiving Day parade or stuff like that. Like when the members are out in the district, they certainly want to meet folks because if they didn't, they just wouldn't do it. And if they are going to be out there, they want to make sure that it's going to be worth their time and constituents will be out there. And I always point out, I say constituents and not voters because we want folks to be involved regardless of your own party, regardless of your elected officials' party. And while we encourage everyone to vote, we certainly don't check the voter rolls to see who has voted and when. But we want everyone to be involved in the political process as much as possible. But also, elected officials want to meet new folks and get out in the community and make sure that the work that they're doing is known and that the work that they can provide to folks is known. Because there's plenty of times where people need assistance with stuff and they had no idea that their representative or the senator could help. And they specialize in anything relating government agencies. So if it's passports, immigration, Social Security, problems with the VA, stuff like that. Members of Congress especially want people to know those are things that they can help with. But when we build relationships with these offices, then a lot of times, then they will come to us and look to us for assistance, or they will say like, oh, we're having a health fair or senior fair or veterans fair. Can you provide us with information about kidney disease or stuff that this specific community should know about? And to us, that's very important because we want people to know about kidney disease as much as possible. Because I'm sure, as everyone here knows, there is a shortage of just general kidney disease info just out in the public. A lot of people just have no idea about it. So the more info we can get out there, the better. And the better relationships we have with these congressional offices, the better, because what happens a lot of the time is then they will pass along this info to the Capitol Hill offices and say like, we've been doing this with the American Kidney Fund. They're great. But this is Bill XYZ is something they wanted to talk about or something like that. And, we build these relationships piece by piece with both the Capitol Hill office and the district offices. But it's important that all of you are out there because as much as I would love to travel, and I'm sure as much as my wife would like to kick me out of the house from time to time, there's only so much that we can do. But, as I look at the list of folks here, I do not see people from the same congressional district. We actually have a good cross section of folks here today. So the more folks can do, the better. As I assume most of you know, I am always more than happy to supply you with giveaways and printouts and other items that you need. We do that usually about once a week. I'll be in the office supplying folks with stuff. So if there's things you need, please let me know. I'm happy to send packages again and again. It's not just a one-time thing. But yeah, if folks just need stuff in general from us, please don't hesitate to let us know. So for you people who are ambassadors in the call right now, do any of you know of any events coming up anything that you are participating in or would like to, that you would like assistance with, or assistance in maybe getting something started in your area? I don't see any hands yet, but see a lot of folks who are active. So when things do pop up, please let us know, because we are, like I said, more than happy to be of assistance. So I guess now we'll just have the Q&A time. So if folks have any questions about anything at all, more than happy to do my best to answer them. It can be about anything that we have covered or anything that we have not covered. So I'll leave. Oh, Sejal, I see your hand up first.
Yeah, I had a question about the grants that you guys were giving for the kidney coaches.
Yeah.
Are we still able to apply for those, or is that not available anymore?
I believe so. I'm writing a note now. I will look into it and then I'll email you
Okay,
the answer.
thank you so much.
Sure. Francis, you can go ahead. You're muted, Francis, if you're trying to talk now.
I have something.
Oh, go ahead, Stephen.
Yes, sir. Good afternoon. Yes, sir. I would like to know, is there anything more that I can do to advocate more on the behalf of the American Kidney Fund and not only the American Kidney Fund, just on my behalf and letting other people know about kidney disease as general, even if it takes involve going to other places and talking to people of other states, I'm willing to do that. So I just want to know, maybe I should be contacting the other person that we met at the fly-in, who's like handling that part. That I forget his name, but I was just wondering about that, sir. Is there anything that more I can do to advocate or more on the behalf of American Kidney Fund and just tell people, because I been going through quite a ride. I've been, out of work for a year and a half, and I wanted to address the question with Mike too. I mean, it's not, and I've been looking for work, but just haven't found anything. And which is very discouraging too, to be honest with you. Yeah. So I was just wondering about that part.
Yeah, I just put the link in the chat for the Kidney Health Coach program. I highly encourage everybody to sign up for that, because that will just give you more training and experience on leading in sort of these public facing education events. And so
Okay.
not only will it teach you that, but there is the grant program that Sejal was talking about that can give you some funding for doing things. So outside of kidney health coach stuff, we do encourage everyone to fill out all the action alerts we have on our website, so that the congressional offices will hear from their constituents, who are our ambassadors, about the issues that we are currently advocating on. And I'm going to put the link for the action alerts in the chat in case you're not seeing them. And then, Stephen, like I said, it's reaching out to your offices and finding out when the members will be out in the district or what things they have going on.
Okay. Can
because-
someone help me? Can someone help me get that so I can reach
Yep.
out to them?
I will absolutely help you with that. Okay, and then the link I just put right now is the action alert one. So folks can just click on that one and then send the appropriate action alerts. That helps because we always need those to be sent to the offices, because sometimes offices will say that they need to just hear from one constituent before they will vote either way on an issue.
Okay.
So a lot of times it's just one. Yeah.
All right. Francis, can you hear me now?
Yeah, I can hear you now, Francis.
Sorry, I'm on the I was on my cell phone. I'm in the rehab hospital after
Oh.
spinal surgery. But it's very interesting that I found out that the rehab center that I'm in actually has a dialysis unit. And I was wondering, is that something new that they're doing now?
I have not heard of that, but that doesn't mean it's necessarily new. What I do know is some jurisdictions and some companies are trying to locate a lot of services in one place, so it's not everything is not spread out all over the place, especially in more rural districts. But I can't say it's necessarily a trend or a constant thing in any specific district.
Okay, thank you.
Any other questions about anything?
Well, shoot, why I can't get rid of it?
Okay, so I will stop the recording now, but we can still stay on for any questions you don't want on the Zoom that will then go on YouTube. So thanks everyone for joining so far.